we want to make sure that we can make it as easy as possible for nonprofits to be able to visit our website, look at our application process, go through the grant process with as little barriers as possible.
We're able to focus on other things and how we can improve our programs.
Being willing to step in to assist and listen is such a big part of the process.
And for small nonprofits, I mean, that is a gold mine.
Welcome to the Roots of Well-Being, where we explore the data, the stories, and introduce you to the people who are planting seeds of change across their communities. I'm your host, Stephen Cavazos, and today we are talking about how MHM, Methodist Healthcare Ministries, has incorporated equitable grant-making principles as part of its 2026 grant cycle redesign. But with me are the experts and the folks that can tell us a little bit more. We're going to start with Alfred Chavito, who is a Senior Grants Program Officer with Methodist Healthcare Ministries, followed by Maggie Alvarez, Executive Director at El Milagro Clinic, and Deborah Franco, Executive Director at the South Texas Juvenile Diabetes Association. Thank you guys for joining me here. And for context, we are here at El Milagro Clinic. Thank you guys for hosting us. We're really excited to have this conversation, but one of the things we were talking about before this recording was how the Valley, we're here in the Rio Grande Valley, is such a unique place that we really want to bring the audience here. For our first episode, we were down at Proyecto Juan Diego in Brownsville, so we got a chance to talk a little bit about the work that takes place there and the unique demographic, the culture here. But what makes the Valley such a unique place?
I think the Valley is just a melting pot of so many different cultures and religious beliefs and just families. And it's just so unique in the fact that we're aligned next to the southern border, but we have so many different ethnicities that are part of our region, and everybody just gets along so well and helps one another. There's such a sense of community here. It's really a beautiful place to raise your children and to grow your business and to be a part of a community that really cares.
It's definitely, you feel that community here. I mean, I'm born and raised in Harlingen, Texas, which is just, if you hop and a skip away from where we're at here in McAllen. But, you really do feel that sense of community growing up, and then just feeling it here for anybody that's coming to visit. You feel that hospitality and that warmth from everybody, and obviously it's shown here by just the hospitality you guys have shown us at El Milagro Clinic. We're going to get a chance to talk a little bit more about the organizations and the mission and some statistics that are very interesting. But getting back to today's topic to discuss equitable grant-making principles, Alfred, this has been something that we've discussed several times. It's right there on our website under the grant-making page of MHM.org. MHM incorporated equitable grant-making principles as part of its 2026 grant cycle redesign. What does that mean for the audience that may be listening in or watching this?
Yeah, so actually this change or this journey started back in 2020 when MHM, Methodist Healthcare Ministries, the board came together, and after listening to the community and seeing what the needs were, started making the shift from strictly focusing on access to care for grant making to really looking at the social determinants of health, because as research shows and as we move forward, we see that being able to take care of an individual and their health needs is the first step. But there's also food security, housing, many other determinants of their health that need to be taken care of as well. So that shift started happening back in 2020. With that change in perspective and way of thinking, we also started doing some focus groups in 2023, where we held focus groups with different communities, different nonprofit organizations, community members, really anybody that is doing great work within different communities, whether it's rural, city, border, and we were getting their input. What are some of the barriers that you guys see as you are seeking funding? Whether you're a small organization, a mid-size, or a larger nonprofit, what are you coming across? What are some of those barriers? What are some of those difficulties? So we took all of that information and started implementing practices for trust-based philanthropy, where we want to make sure that we can make it as easy as possible for nonprofits to be able to visit our website, look at our application process, go through the grant process with as little barriers as possible. So that brought us up to 2026.
Yeah, it's been a long time in the making, and I think one of the things you talk about is those focus groups. What was really some of the things that they did bring to your attention in the focus groups?
Yeah, so really aligning with some of the research that's out there, right? Is coming and talking to the nonprofits and the community members and seeing what are some of the things that may be keeping you from either applying or applying but not necessarily being successful in receiving grant funding. And it ranges from the size of the application process. You see some applications that are 10, 15 pages long. And when you're talking about a small organization that has very few full-time employees or some organizations that are volunteer-based only, they really have a difficult time in having the capacity to be able to build such a robust application and then maybe not even get it funded. So you put a lot of time and effort into being able to apply. So that is one of the big things that we saw, that administrative burden. You are successful, you get a grant, but then you are bombarded with reporting, monthly reporting or quarterly reporting, and then the reporting is so long that they spend so much time on that when they could have been spending time with their clients.
Correct.
So those are some of the key things that we saw.
Why does equitable grant-making principles, why does that really matter?
That's a great question. So one of the things that we want to make sure is that we have an opportunity for any organization to be able to come to the table, listen to our grant process, and then be able to apply. Have the capacity, whether they are a small nonprofit or a large nonprofit, provide the same opportunity for every organization within the 74 counties that we provide services to. So that is one main thing. We want to make sure that everybody can come, apply, go through the process, and determine whether or not their mission aligns with ours.
I do want to talk about the organizations that are with us today. As we mentioned, we have El Milagro Clinic and the South Texas Juvenile Diabetes Association. We're here at El Milagro, as I mentioned. Tell us a little bit about this, the mission here, because you guys have been a grantee of MHM for over 15 years. So tell us a little bit more, Maggie, about what this clinic does.
Yes, so we provide comprehensive primary health, disease prevention, and integrated behavioral health services to all Rio Grande Valley residents who are medically indigent. And, we serve everyone. We have people even from San Antonio coming in.
Wow.
And because they used to live here and they love our providers and they're willing to travel to get services that they need. So we're happy with all the services that we are able to provide for our patients. I mean, and not only that, we also offer counseling for our patients. We have a food pantry, we have a mobile unit, we go out to the colonias and provide services for our patients out there. We have a lab, in-house lab, and nutrition. That's a big one, especially for our diabetic patients, because it's important that they know that it's not just about the medication, it's also about changing your behavior and learning how those great food that we all love, but how can we make it healthier for them?
And I think that ties in great. We just talked about, collaborating with other organizations and really just with this mission that you guys have, the South Texas Juvenile Diabetes Association. Deborah, you mentioned 26,000 people served on a staff of 5. That's
Yes.
incredible.
Yes.
Tell us a little bit more about what you all are doing.
We run 9 programs that help support children living with diabetes and their families, everything from medical supplies to support group meetings and trainings and camps. And we're really trying to give children and their families the support that they need to be successful in their diabetes management. And it's kind of a full circle. I mean, going back to the Valley, it's full circle. Like Maggie was saying, you know, we kind of take care of all aspects of care for our families, not leaving anything out, because we know that in order for them to be successful, they need to have all of those things addressed. And that's what we want. We want success for all of the kids that come through our building.
And one thing I also want to ask, I mean, with both organizations, completely grant funded. I know you mentioned you guys are completely grant funded. And how about you guys? Are you guys completely grant funded? Yeah. I think it speaks to the overall importance of how grant dollars are so important for organizations, because there is this reach out in the community, and not having those grants can really hinder the mission. Tell me a little bit about what it's like to really apply for those grants, because you guys would have to apply annually. You mentioned at one point, right, Maggie?
Yes. Back a few years back, we did have to apply annually. It was stressful, right? And especially here in the Valley, we're very limited in the grants that we can get. There's not very many foundations that will fund the Rio Grande Valley. So we're always having to be competing for that money, you know. So there was a change, you know, that I love, because now it releases the stress. And you know, we don't have to worry about it for another few years. You know, once we apply once, and it you know, it goes on for a few years, and then we reapply again. But the stress is no longer there. We're able to focus on other things and how we can improve our programs. We listen to our patients. What is it that we can add? And all we have to do is communicate that with our partners, you know, and they're always willing to help everywhere, you know, that anything that we need.
And that's so important, is really that being willing to step in to assist and listen.
Yes.
It's such a big part of the process. But, you know, even looking, as you mentioned, you were talking about sometimes it's trying to find the right funders. You know, what is the challenge in looking for the right funders, Deborah, to help fund that mission?
I think the hardest part is every funder, every foundation, every person that has funding available has unique an outline of what it is that they want to fund, and how does your organization and your programs fit into that box. And I think that's the hardest part. And so I think that, you know, MHM is kind of an outlier when it comes to supporting the community and supporting even the people that they fund, from navigating the website, you know, just so many examples on how to apply and guidelines as to what that should look like. It's very, very helpful, especially when you're talking about such a tiny organization that really does everything in-house. And then they go on and continue to support the funders as we have questions throughout the reporting period, throughout the funding period. You know, they're constantly there to support, to guide, to answer questions. And for small nonprofits, I mean, that is a gold mine. That's huge. That's like having another staffer.
On a staff of 5, right? That's that 6th person there. You know, and that's great, because, you know, looking at the website, Alfred, I mean, you see it is very specific, right, as to what these grant seekers are looking to find. That information that can be so imperative. In terms of this grant cycle redesign, how did MHM leverage its sources there to help really kind of finesse the message to those grant seekers?
Yeah, so as I mentioned, we did some focus groups. We were able to get a lot of information from our community partners. Being able to take that and then get with MHM leadership to see if we would be able to implement some changes. For example, for 2026, we were able to introduce small grants. We were able to do a renewal for 2025 due to some of the changes in federal funding and cuts to federal funding. Our MHM board and leadership got together and said, how can we go about supporting some of our current grantees? So we did a renewal for that. And it's really learning to be adaptable to the changes in the environment based on what we get from our partners, based on the input, based on the need, the changes within the community. So as we take that information, we're able to look at our current processes and then make those changes. And our leadership has been very supportive on making those changes. and making it hopefully a little bit easier to be able to support some of those nonprofits in the community.
And we're going to get into it a little bit later about what the differences, some of the differences specifically with the standard grant and the small grants there on our website. But with El Milagro being a grantee for 15 years, seeing these changes, what does that mean to you, Maggie, as the executive director here? And also, what does it mean to the people that this organization is serving?
Well, I'm fairly new in my position, right? So I didn't really get to experience the way that it was before. But from my colleagues, listening to him and hearing their stories, it was just so much simpler, easier to navigate. They were able to focus on specific programs, that they were applying for. And for patients, they're so truly grateful. Their success stories, just sharing success stories. I know that Alfred has asked me, if we can send them, a few success stories, and not just Alfred, other foundations. But I think that's key, because you hear my story and how I tell it, but when you're hearing it from the patient, it is so moving, because you can feel how grateful they are to receive just simple medical care, or even a box of food. They're so grateful, because otherwise they're put on a do I pay for food today, or do I go to the doctor? And when you hear things like this and you share this with the foundations, and they're willing to come and help with that, it just breaks my heart, to be quite honest. And it's great that we're able to help out in anything that we can with for our patients. We listen to them all the time. We always ask them, what is it? What else can we do for you? What is it that can help you improve? And, we share that. And that, I think just them knowing that we can, or that we're interested, and that we are trying to do something for them, is the best that we can, that they can ask for, I think.
It's bridging that connection and bridging that gap of understanding, and why these grant dollars are important. Because again, this El Milagro being completely grant funded, you understand how detrimental not having those funds would be to these patients. As the grant maker and as a grant seeker, how does trust really change the dynamic and the outcome?
We are there for all of our partners, that we continue to listen.
If you have any challengers, they're here to help, and to funders, to model that example, because it was really, it was a burden lifted off my shoulders.